All right, here we go. Here I am. I thought I'd just share this blog posting as a vlog. I thought it'd be easier to say some of this information than to type it out, and that way I could explain myself more naturally, which is verbally than written. But thanks again for the last couple of weeks for joining us in discussion and reading through some of the material that I've been sending you, all for the benefit of preparing you for this concept-based curriculum change, which I know still sounds maybe kind of vague, and even it's so new in practice that there's a lot of things that are just being learned about this new kind of curriculum. As far as clinical, it may or may not change your environment significantly depending on how you're already processing through information. But one thing I wanted to share a little bit about was this concept between clinical reasoning or clinical judgment versus skill development. And depending on how you were trained as a nurse, you're probably doing training very similarly. And depending on how experienced and how old your nurse was, your clinical instructors were, reflects even how we learned, how we were taught as students. But this shift towards clinical reasoning is really, really important. We've spent in the past an exorbitant amount of time trying to prepare students how to do nursing. How to do baths, how to do vitals, how to do finger sticks, how to do NGs, how to do IVs, how to do Foleys. And we look for these experiences, and students, they cry for them. Well, I want to do an IV, and I want to do a Foley, and I want to learn how to do that because that's what nurses do. And I tell them, look around. How many nurses do you see putting in Foleys and putting in IVs on a floor? Now, ER might be different, surgery might be different, but in the environment that most of us are in on a routine basis, the nursing staff on the floor don't put in that many Foleys. They do a few IVs, but even those, I'm noticing nurses are calling, IV teams and pick nurses to come and help and charge nurses to come and help, which isn't a good thing. I mean, I want my students to have the opportunity to try to start an IV and see what that's like, and if they get it, great. If they don't, no big deal. But those kind of experiences grow from experience. You don't learn how to be competent in an IV or Foley the first time. And if you're only getting a chance to do one a semester, you're not going to become competent in it. What I'm becoming more interested in, and what concept-based learning and teaching is more interested in, again, it's not putting skills, in the trash. We need to teach students how to do those. But what it's focusing more time on is the how to think like a nurse, how to process through information, asking an exorbitant amount of time spent on questions. Lots of questions, lots of, well, why would you do that? What would be next? What would be the priority in this situation? If you only had 30 seconds in the room, what would you focus on? Trying to get students to really grasp the importance of each moment that they have with their patients, of educating them well, of teaching the patients well about their medications. And in order to do that, they have to know their medications. NCLEX is spending a lot of time changing, and they change their test every 3 years, and they grow it and they develop it and they make it harder. But this last shift, they started adding a significantly higher percentage of questions on pharmacology, on the background, on pathophysiology, and the nursing education, and if a patient says this, would that be a good thing or a bad thing? So a lot of questions on pharm and the understanding of pharmacology. And in order to kind of do my part, I've shortened the number of times that students pass meds because I've learned that they become competent in passing medications with just a few med passes. How to do 3 rights, or 5 rights 3 times, how to, scan the patient and go through the medications in the computer and documentation. They become aware and competent, basic competence within just a few med passes. What they lack is the decision-making ability behind those med passes. For instance, you have a patient that has Ducasate. What's that for? And the students will answer, it's a stool softener. And so a lot of instructors will think that that means the student understands it. So what I've followed up with that is, so am I going to give this medication? I'll ask them, are you going to actually administer this med? And it kind of throws students back sometimes because they go, well, it's for stool softening and the patient's on narcotics and it's on the MAR to give right now, so yeah. But what they miss is the big picture. And then I say, well, what's their current bowel status? Because you told me earlier they were having diarrhea, but you didn't just remember that at this moment. You were going to give them a med. Oh, that's right. Yeah, they have diarrhea. So I'm not going to give this medication? And a lot of students early on struggle with taking that theoretical knowledge and putting it into practice. And the only way we're going to get them to make that very large step is to ask them questions and make them process through that and give them an opportunity to fail at understanding that, you have low pressure. What are you going to check? Well, it's for blood pressure, so I'd check their blood pressure. Great, okay. And then that's all they say. They say, well, yeah, I check their blood pressure and I check their pulse. Okay. Is there anything else you want to know about the patient? Yeah, I'm sure there is, but maybe they don't get it. Maybe they do. Just general assessment findings. But what I find is then I let the student go through the steps of pulling the med out, going to the room, educating the patient on what this is. This is for your blood pressure, to manage your blood pressure, because you have a diagnosis of hypertension. And the students do that really well. But then when I say, oop, time out, and sometimes I'll pull them out of the room and I'll say, are you really going to give this medication to the patient? Well, yeah, I went through all the steps. What was their blood pressure? It was 86/44. Pulse was 110. So you told me that the med book said, and this is the conversation I have with the student, you told me the med book said you check their blood pressure and pulse before administering. You told me it was for blood pressure, it was for hypertension. Yes, they have that diagnosis, but you need to know what their blood pressure is right now, or within the last couple of hours. And you said the right thing, they say the right thing, but you didn't understand what was going on behind that and what you really needed to understand. And I find that really unique or ironic that for a while, for a number of years, I interpreted the students' right words as right understanding. And I've learned in the last couple of years that the right words do not always mean right understanding. And so this clinical reasoning versus skill development, I've really started to put skill development on the side. When it comes up, great, but I'm not looking for it as much as I am looking for scenarios to ask good questions about right understanding. I hope this really gives you some insight into maybe, depending on how long you've been a clinical instructor, you may have come up with this epiphany before I did. And that's great. I'm glad that you've found this truth of the difference between right words and right understanding and what that really means in the clinical setting. But I hope some of you maybe, and I'm thinking some of you may be early enough in your clinical education, clinical teaching environment that you may not have come across this yet. You may not have experienced that difference or even thought of it. Because I know I hadn't for a number of years of teaching. So I really just share with you encouragement to really go after clinical reasoning, the concepts, how labs connect with meds and connect with disease processes and assessments, and go deeper than the words. Find out if they really understand this material. Again, I hope this has been beneficial for you, and I look forward to more opportunities to share what others have taught me and what I've learned from experience, and maybe you even have some points that you think others could benefit from, and we can set up a vlog for you to share some of your insight with other instructors. Again, thank you, and have a nice day, night, morning, whenever you get a chance to watch this. Have a good one. Thanks. Bye.